Hello, everyone. I'm Professor Dr. Faraz Farishta, MD of FS Endocrine and Diabetes Center and Professor at Medicity Institute of Medical Science, Hyderabad. On occasion of World Diabetes Day, I think I would like to emphasize on the most important part of access to early diagnosis. We all know now that India is second in the population with people having diabetes after China. And this is expected to rise to more than 134 million by 2045. So we do not want to be number one when it comes to the number of people with diabetes. And then it is estimated that in India, in the cities, almost 20% of the people at the age of 20 and 40% of at the age of 60 may have diabetes. So what we are seeing now is just the tip of the iceberg. So definitely, I think it is very important for us to, I would say, spare a moment on the theme of World Diabetes Day for this year is access to diabetes care. So this highlights the importance of early diagnosis because we all know that if we delay the diagnosis, the patient has to pay the price for it. Why it becomes very important is because 42% of the people with diabetes in India remains undiagnosed. So you will see one out of the two remains undiagnosed. There is high prevalence of micro and macrovascular complications, which happens at the time of diagnosis. So delaying it further increases the risk of complications. And HbA1c value of a newly diagnosed patient in India is as high as 9.1. So that itself talks a lot on how we are lagging when it comes to screening of diabetes patients. So yes, so there are problems. So let us discuss some solutions for these. I think diabetes progresses silently. You will not feel the symptoms until late stage of the symptoms. So it is important to undergo blood sugar testing every yearly and very early. I would say any individual about 30 years, females with past history of GDM, obese, females with family history, and then anybody who is having family history, anybody who is having blood pressure, anybody with dyslipidemias, anybody with thyroid disorders, all these patients need to undergo a sugar check at least yearly once, if not more. And we should actively participate in various free screening programs conducted, I would say, by the government. There are so many societies, the pharmaceutical companies which are doing it. So we all should be a part of this mission. I think I would like to press down on 3 T's here: test, track, and treat. So I would again repeat it: test. So early testing is very, very important. Tracking, the second T is tracking, where we have to track the sugars, or we have to track this pre-diabetic patients, and if they get into these diabetes stage, we need to treat them. So I would like to end my talk here again with a mantra by saying that let's get down 3 whites from our lives, that is rice, salt, and sugar. So stay healthy, stay fit. Thank you so much.